Hello people, in this video we want to look at this topic Duchenne muscular dystrophy, DMD. So basically it is some type of muscular dystrophy. So basically there are many types of muscular dystrophy. That means muscle has some weakness, okay, wasted muscles. Why? Because there are many types, like we are telling you. There can be Duchenne in which there is no dystrophin. Dystrophin is one anchoring protein, okay, which that anchors the actin to sarcolemma. The dystrophin, I'm writing here, DYS TROPIN. This dystrophin is completely absent, okay. So this is Duchenne muscular dystrophy. So in this, what is happening? There is no dystrophin protein at all. In Becker muscular dystrophy, what happens? The dystrophin is actually a little less. It is less in quantity. So did you get the whole concept of what we are looking at? So Duchenne muscular dystrophy, it's a type of muscular weakness where the dystrophin is absent. Okay. So DMD. So if the dystrophin is less, that becomes the Becker one. But here it is totally absent, remember. And this is an X-linked recessive condition. So it is hereditary. You will get it from parents. And it is affecting male, because why? It is X-linked recessive. So they have only one X chromosome, remember. They are XY, right? Males. They have only one X chromosome. So they are affected. Muscles are the problem here. It is nothing to do with the nerves. The nerves are giving perfect signal to the muscle. So here's your nerve, and let's draw a muscle here. And let's draw a muscle. I need a brown, but there's no brown here. So there is a muscle here, okay, and there's a nerve here. The nerve is absolutely fine. It's the muscle that has all the problem. It doesn't have dystrophin, so it is not able to work. So dystrophin is what? It is an anchoring protein that anchors the actin to sarcolemma. So if you have understood how muscles work, you know that, right? So here you are looking at all that complicated muscle, how it contracts, right? So sarcolemma, where is sarcolemma? Actin, you can see here, actin binding site is marked here. Here, actin binding site, they are shown here. Actin binding sites, these are. This entire Z line to Z line is a sarcomere. This thing is a sarcomere. So it has the, from here to here is the sarcomere. Why did they use the word sarcolemma then? So basically, actin to sarcolemma, they are saying, has to, sarcomere, let us say, it has to anchor it. That anchoring protein is not there, okay. So there is that strength to myofibril, I think, is not there. So this is what is absent, okay. So that is, the muscle is not able to work, though the nerve is giving it all the signal. So here there will be what? There will be degeneration and necrosis of the muscle fibers. The muscles are dying. How sad, right? The degenerated muscle fibers are replaced by fat and fibrous tissue. So now that is what they have shown in this image, right? The muscles are getting replaced by fat and fibrous tissue. That's what they are showing here. See, the muscle fibers are replaced with fat cells. So that's very sad. We need muscles, right? Sometimes there can be a reverse, that there could be enlargement of the muscles, they are saying. Pseudo hypertrophy. It is not actual hypertrophy, pseudo. So what happens finally? Even the respiratory muscles will give up. Okay. And as the respiratory muscles also give up, these people will have difficulty in breathing, and then they may attain death. So let's look at some more points here. So it's X-linked recessive, we told you. So which gene is affected? The dystrophin gene, DMD gene, which is located on the X chromosome at P21. So which exact location is XP21? They are saying, if you want more thing. So it is in 1 in 3000 live male births it will affect. It will affect male, we told you. So how will the clinical presentation of this person be? There will be delayed motor milestones. Obviously, the child motor milestones, walking, crawling, all that will be slow. There will be speech delay also. Do you want me to write that here somewhere? Wait. So we told you motor milestones delayed, speech is delayed. So those are symptoms. What about this? When you do lab diagnosis, you will see creatine kinase levels are elevated. Okay, so let's put this as an elevated thing. It's not a red, actually it's elevated. That's why I'm not putting. It's not less, it's more. See? Ambulation is lost between the ages of 7 to 13. That is, they are not able to move around, right? The lifespan will reduce and they will die because of respiratory failure in mid-20s. That's what the book says. Cardiomyopathy affects most boys and female can be carriers because they will have 2 X chromosomes. That's understandable. So it's not like it's purely male. It can happen that, a female has to get 1 X chromosome from her father. So it is, if the father is affected, he is not alive. So it is not possible for a female to get. Are you getting what I'm saying? Because an affected male lives up to mid-20s, they are saying. He probably would not have passed on his X chromosome to the daughter. But it is possible, right, that a woman also can get the disease if her father was young. Okay, so now you got all what I was trying to say, right? So even heart is affected because heart is a muscle, isn't it? Cardiomyopathy. Okay, what else? That's all we wanted to say, people. This is some Grover sign. You can see how the child is trying to grow up. To stand up. This is a Grover's sign. So he will use hands to push on legs to stand. Okay. So this is all about Duchenne's muscular dystrophy. Remember here the entire dystrophin itself is absent. Okay. But in Becker it will be reduced. Becker muscular dystrophy, the dystrophin will be what? Reduced. Yes. But here it is absent. You got Duchenne's muscular dystrophy. Bye-bye. Oh wait, we did not discuss the treatment, right? So now let us look at just a treatment also. So basically the muscles which are affected are the proximal muscles and the limb girdle. What is limb girdle? They showed something here in this photo. Limb girdle. That is something that is supporting the limbs, is it? Or attaching the limbs. So that part is affected. So basically the arms and legs, that's what they are trying to say, okay? So proximal muscles and limb girdle are affected, okay? Now how will you manage? So we have come to the treatment also, people. There is no specific treatment they're saying, but there is physiotherapy and occupational therapy. So to help them have an occupation at least, something like that they're telling. So physiotherapy, so for muscle strength, etc. Glucocorticoids can be used. That is, a steroid can be used, but it will have side effects like, any steroid, immunosuppression. Other things about steroids, you should know what the side effects will be. There is something called as ataluren, a compound. So it can arrest the functional deterioration, potentially reduce or arrest functional deterioration. Will this really work? Theoretically, it will lead, is it, to this? Okay. And whenever there is some cardiac failure or arrhythmia, only those things which are failing they are trying to fix. So symptomatic treatment kind of a thing. So they are giving a pacemaker if necessary to these people. So how will you manage respiratory complication? They are not able to breathe means you have to give oxygen and any ventilation kind of a thing, right? So you will have to manage the respiratory complications. Improvements in non-invasive ventilation have led to significant improvement in their survival. Genetic counseling is important so that this boy does not go and procreate. Is that the right word to use? So guys, did you get the treatment management? It's not more like treatment, it's more of a management. Ataluren, steroid, physiotherapy, occupational therapy, pacemaker for the heart, non-invasive ventilation, genetic counseling. This is the treatment, okay? Management. Yeah, both.